Hello and good morning. Today I want to talk to you about the need for having an explicit positive reporting system. Our work environment is shrouded with low morale, negativism, and burnout, and I believe that this will be an important weapon in this fight. I have titled this as Moving from Safety 1 to Safety 2, and I will explain why during the course of this presentation. I'm most grateful to Dr. Adrian Plunkett, who established Learning from Excellence, or LFE for short, for allowing me to use various resources from his website. I've broken this talk into several sections. Kindness is the linchpin for this talk, and positive experience reporting system allows one to express this kindness formally. I will talk to you about how this fits in with safety, how we can capture the positive experiences, and how to implement this in any workplace. And that's not all. I will also explain how we can take this to the next level by appreciative inquiry to learn and amplify positive actions. Now I will go through the different sections of my talk. The first section is my understanding of the difference between Safety 1 and Safety 2. This was first described by Professor Holnagel and Professor Weir in their white paper. Let me explain. First of all, what is safety? Most of us would agree that in the simplest form, safety is when there are no negative outcomes or absence of errors. What runs through your mind when you look at this? I bet everyone quickly picked out the error. This is how human mind works. It can easily pick out an error, but generally not something that is good. 80% of the sum in this table is correct. But we talk about the 20% which is not right. On a day-to-day work, however, much higher percentage of things go well, but we focus on things that have not gone very well. In the white paper written by the two professors, they point out to this exact conundrum. You can see from the bell-shaped graph, a lot of things do go well. Safety 1 focuses on things that are on the left side in red. It is generally a small percentage of events. However, in real world, despite many variables, often things go well. Usually, it is not a priority for an organization to try and understand how and why things went well. They do look for exceptional achievement and reward them infrequently. In contrast, in Safety 2, the focus is in the middle part of the outcomes where things generally go well and focus on positive things. Safety 1 focuses on few things that go wrong. It's a more reactive management, and the aim of this is to identify a cause for the negative outcome and to address this so that this is not repeated. This is usually done by root cause analysis. Here, humans are generally considered to be a liability. But in contrast, Safety 2 accepts that many things go right and look at the reason why something went well and tries to amplify this by using appreciative inquiry. In my mind, the critical difference between these two is how they deal with human factors. Even though the holes in Swiss cheese should be lined up for an error to materialize, not too infrequently, a root cause analysis may leave a sour taste in the mouth of those involved and make them feel a part of the problem. However, in Safety 2, humans are looked up with a positive eyes, and the ways to identify and amplify their good actions are considered. This certainly will leave a much more positive feel in the person involved. Whatever safety measures are put into place, bad things will still happen. In a similar way, despite different hindrances in the system, exceptional things still happen. The bad things are captured by GREATix, and the exceptional things are rewarded by CEA points or Staff Hero Award or such. But a lot of good things are usually brushed aside as normal and considered to be expected outcome. We neither have a way to identify the simple good acts, nor do we reward them. How can we do this? Enter LFE, Learning from Excellence. LFE was a movement started by Dr. Adrian Plunkett, who was who has devoted so much of his time and energy to promote recognition of positive action. LFE originally called reporting of the positive actions as excellence reporting. You can know more about this by visiting their website, which has wealth of information. There are many names for positive reporting system. As mentioned before, LFE called it excellence reporting or ER. In Salisbury, they call this SOC or sharing outstanding excellence. It can also be called blandly as PRS or positive reporting system. But I do like the euphemistically named GREATix. This word GREATix was coined by Dr. Sinton when he was working with Dr. Plunkett in Birmingham. It was developed as a word play to contrast DATix. Of course, if we want to give a local flavor, we can call this as repeat or reporting positive experiences at Torbay, or previously established showing acts of kindness or SAC. But to prevent different names mushrooming out in different centers, I think GREATix is an apt name for the system. I'm sure GREATix would agree. Going back to the model developed by Professor Holnagel, we can now see where DATix and GREATix fit in. DATix will capture not so good things that happen and address this through safety 1 issues. GREATix could capture all the other positive related activities. Here is a summary table comparing DATix and GREATix. Both DATix and GREATix can be used for clinical governance activities. They will be helpful for changing practices and will also be useful as a tool for appraisal. Whereas filling the DATix form is time consuming, we can make the GREATix form easy and simple. The motivation for DATix comes from motivation for change in DATix comes from negative feedback, whereas in GREATix comes from a positive feedback by amplifying all good events. Positive experience reporting or GREATix will improve quality of work, will promote joy of work. We can learn from positive experience, will amplify good practice, optimize patient experience, strengthen the team, will be helpful for staff appraisal, develop services, and most importantly, increase staff morale and foster innovation. Appreciation can make a day, even change a life. The willingness to put it into words is all that is necessary. When one appreciates, there's a lot of dopamine release in the brain, which will counteract the stress and will help in improving the morale. Let me now move on to the next section of what is really needed to show appreciation. As mentioned, the key element for positive reporting is showing appreciation. It does take a special level of attribute to show this. It is kindness in one's heart. I believe that one of the key elements for low morale is absence of kindness in the system. Just like darkness, it is not easy to define kindness. Absence of light can be noticed as darkness, and so too the absence of kindness can be noticed. You will know when the kindness is not there. Julia Unwin tries to tackle the lack of kindness in the conventional system in the article she wrote when she was the Carnegie Fellow. There is generally a degree of stigma attached to expressing kindness by the policymakers or the system in which one works. There is so much of negative connotations attached to it when it comes for recognizing and expressing kindness. I will leave you with few quotes from her article. She goes on to say that kindness should be appropriately expressed. If kindness is not shown correctly, then it can be misunderstood as being patronizing or even as perceived as condescending. It's very important for one to express the kindness correctly, and this is not easy.